today we have something to share. We have something to share in English, okay? Please ignore my lousy English. Okay, my name is Mindy. So I have my ex-colleague with me today. Her name is Mei because she has a very good result on Aulora test. And do you consume Shiruto now?
Yeah.
How many sachets you consume? 4 sachets a day. Okay, because SLE is something very special. So what about we let Mei introduce herself, then tell us more about SLE.
Hi everybody. SLE basically is maybe it's a quite not so common problem, but according to doctor, it's like I guess in the recent years, it's also having more and more patients with this condition. So this is actually under autoimmune disease, whereby our immune system is overactive.
Attack each other, is it?
Yes, because it's overactive, so our body does not recognize whether it's our own body or not, so it will attack. So it attacks depending on which area. So some is affecting like maybe on skin, some is affecting on joints, some can even attack on organs. So it's very much depending on individual condition.
And because we have been know each other for quite some time, since 2014. So there's sometimes she having rest at home. So we are very curious why suddenly she don't work anymore. And then she told me that time she was having SLE and the cells is attacking her joint. That's why she cannot get up from bed. She have to bed rest. Is it? We call it bed rest.
Bed rest, but minimum movement, because every time it moves, then you have pain. So
move like robot.
Yeah, correct. So you have to walk very slowly. Then it will be better lah.
What happens if if it gets worse?
It's supposed to be controlled by medication. So if the SLE activity is being controlled, then basically you won't experience symptoms. No symptoms means no pain, for instance. So if there is pain means there is a symptom. So as it gets worse, then it can affect to more of the joints being inflamed, so you'll be more painful. And if condition gets worse without control, then it can be affecting to other parts, like maybe you will have an infection and things like that.
Oh, seriously, I didn't know about SLE previously, but today after meeting her, I learned a lot about SLE. So how long you have been encountering this problem?
I got the condition in 2014, but after few months, then it's be controlled, and then
taking medication.
Yes, taking medication, then it's controlled. So there is a condition, we call it remission. Remission means there is no symptoms, so it's like normal. So I have been normal. I mean, in the normal condition.
Previously it's abnormal.
Yeah. So only until last year, then the pain joint comes back.
Okay, because she has been taking Shiruto and she has been wearing Aulora pants for quite some time, but honestly, she don't wear for 24 hours previously. She just wears song only. And then Shiruto also she never take consistently. So recently I get back to her, then I told her, why not you try wearing 24 hours for the Aulora pants, and one day you take at least about 4 to 6 sachets to just to really focus and see what is the result you can get. And surprisingly, she has a very good result to share. So let her share this.
Yeah. So
after wearing for 24 hours.
So after wearing for 24 hours, then I realized that the knee pain gets lesser. So when it feels, the difference is like maybe about the 3rd, 4th day. So my knees feel less pain. So I thought, okay lah, maybe just coincidentally. So I continue wearing it for about a week. Then it actually gets lesser. Then I stopped wearing because I want to see whether does it make a difference lah. Yeah, honestly, yes. So if I stop wearing for about 2 days, then I can feel the pain is slowly coming back. So from then I put it on back for 24 hours because I try not to let it be worse lah. So continuing it for 24 hours for maybe about 2 weeks, then the pain is actually much reduced. And because the pain started from last year, so my right knee is the one that is inflamed for a long time.
Only right.
Yeah, because from last year the right knee started to get pain, and then slowly until this year only the left together. So my right side one usually is I can't bend, so I can't squat, and then I can't fold my leg in.
Then you're like grandmother already.
Yes, like the old elderly people like my mom. My mom having knee pain, so she also can't bend her knees, cannot fold that kind.
This is what people say lah, 美楼心碎.
Yeah. So after the 24 hours for about 2 weeks plus, then the right side is actually much better. I think it's repaired on the inflammation. So I can fold my leg in, I can bend, and almost can squat. So I see it's quite a big difference, because when I start to do some exercise classes like yoga, so I realized that there are many poses that I can do now.
Wow.
So yeah.
Then you don't have to walk like robot anymore.
Yes, yes.
Because my husband last time saw her walking like robot. Okay, then you said how many sachet of Shiruto you consume a day consistently?
Now it's 4 sachets. So when I start to consume back consistently, it's 4 sachets.
Okay. Do you still take any medications?
Yeah, still taking medication.
Okay. So this is a very good result, because she was in pain since 2014. Then now she after 24 hours and after taking for the Shiruto, she has been taking medication for quite some time, but there is no improvement until she wear Aulora pants for 24 hours and also take Shiruto together. Then only she feels the difference. This is why it is very important for us to really focus and really wear for longer duration in order to get a better result. Anything else you would like to 𝗏𝗏?
Add on, I guess nothing much, but for those who actually having pain, whether it's a condition or not, or injuries, it's worth to give it a try, because it can actually give you much comfort. Because when you are not in pain, then you can actually have a better quality of life and you can perform more activities. So this is what I feel. So that's why when I meet other people that having pain, I always tell them you should actually try the pants, because it's just put on, you don't have to consume it, so it's nothing to be worried about. Yeah.
What pants is this? You keep mentioning the pants, then you never mention what pants is this.
From the start you mentioned it's Aulora pants with the
Okay, I just need a clarification from her. Okay, so thank you guys for watching. So this is a small little sharing from her, and actually there's 2 kinds of SLE, is it?
There are many types actually, because it's depending on which area it affects you. So it's under one big family, it's called the SLE, under autoimmune. So in SLE itself, it can be affecting to different parts of your body. So it's depending on which one.
Wow, we really learned a lot today, and we just only know that SLE can cause death, is it?
Yeah, in serious condition where it affects the organs, then you tend to have infection, and if it's not being controlled properly, then it will affect like organ failure. Then in the end, the serious case will lead to death.
Wow, this is very scary. Please don't play with this, okay? Take it seriously. So I hope you guys can share this live to people who have SLE also, so that they really know more about SLE and how can our product help them to reduce their pain. So thank you, 𝗲𝗠. Actually, she said she's very camera shy, but I don't care. Thank you, 𝗲𝗠, for sharing. Thank you guys for watching. Bye.